Hello, I'm Anita Benson and I'm the Director of Nursing. I'd like to discuss today's the signs and symptoms of a stroke and the preventions and modifiers. FAST is an acronym that we currently use. F stands for face drooping. Is one side of the face drooping, numb, or tingling? Ask the person to smile. A stands for arm weakness. Is one side stronger than the other? Is one side numb or tingling? Ask the person to raise their arm. Is one side drifting downward? S is for speech difficulty. Do they have slurred speech? Is it comprehensible? Ask the person to say one simple sentence like, the sky is blue. And T is for time. Time means everything. If anyone has any of those symptoms, call 911 and get them to a hospital immediately. Modifiers and preventions. Control your blood pressure. High blood pressure damages blood vessels. Speak with your physician about the best way to control your blood pressure. Reduce your cholesterol. Eat low-fat, high-fiber foods. Stop smoking. There are multiple programs out there. Exercise. Exercise 3 to 4 times a week for 30 minutes a day. Vibra Rehab Hospital is stroke certified and can get your brain and your body on the right road to recovery. Remember, the quicker that you start therapy, the better outcomes you will have. We also have a stroke support group that meets monthly and discusses topics that are beneficial to you and your family members. It's open to the public, so call us today for more information. We look forward to helping you regain your independence and getting you back to better.